Welcome to Rubin On Point, a podcast about cancer, resilience, and being human. I'm Dr. Dan Rubin, and together we'll uncover the true power of resilience, the strength to recover, adapt, and thrive through life's toughest challenges. Each episode will bring bold ideas, transformative practices, and inspiring stories that redefine what health, healing, and what the human spirit can achieve. And you're going to meet some really cool people along the way. If you're ready to turn obstacles into opportunities and live with greater purpose and courage, you're in the right place. Let's get started. Your journey to resilience begins now.
Where do you get those?
eBay.
eBay?
Amazon.
eBay, how old are you?
Hey, I just... Oh my God. I still do look on eBay.
Oh my
For
God,
like
you're like my dad.
Weird stuff.
Yeah, I got it on eBay.
Yeah.
You know, there's Amazon.
Yeah.
And it comes tomorrow.
Yeah. Oh my God. All right, everybody. Thank you for joining us. This is Rubin On Point. I'm Dr. Dan Rubin. And on this podcast, we talk about cancer. We talk a lot about resilience, and we love to talk mostly about what it is to be human. And I'm with Dr. Keiko Finnegan, and I'm in your house.
Yeah, you are. Welcome.
I am at Kinfolk Optimal Living. I'm familiar with it because you guys are my doctors.
Yeah.
And it's so good. I get such a good feeling coming here, parking, walking in. The space is so peaceful. Even while we're doing a podcast, the energy is good. And I know that you've created a balanced space. I refer a lot of patients here, and I refer a lot of practitioners here, and I refer a lot of friends. I still don't really know how to tell them what it is. Or when I say, they're like, well, what is that? Or I'm going to Kinfolk. Well, what is that? Or what do your doctors do? Like, I don't really know how to say it, which is why I love talking to you guys, because Dr. Sera's over there, so we'll probably bring her in to answer some of these things. Hi, Dr. Sera. So we need to chat about that so people know what this is, and so I know what it is, and so my patients do. But first, tell us about yourself, your degree, your schooling, your background, because you got here and invented this somehow.
Yeah, I mean, Sera and I met in Dallas, Texas at Parker University and, did 4 years of chiropractic school, graduated. We were not practicing this way. And
you were traditional?
Traditional chiropractic, but still, like, we loved craniosacral. We loved, there's more of an energetic essence to some techniques too. But, they certify you, you learn 10, 15 techniques in school. You can choose to blend them as a practitioner later, or you stick with one. Some people just stick with one.
Okay.
But I think for us, we met so many great mentors who are practicing in a different way. And we just loved the bioenergetics of it. We loved how gentle it was. And it matched the philosophy of how the body heals, right? I wasn't there to fix the patient, right? We were there to open up the system, get the healing response in the body to work. And it just meshed so well with what we do with our hands back here, because it is a gentle approach, and anyone can get adjusted with this type of approach, cancer patients specifically. I mean, in school, they said, well, you couldn't adjust cancer patients.
Wait, the people with cancer would be at risk for being adjusted because you might interrupt a tumor?
Exactly.
Or create metastatic spread?
Especially with metastatic stuff in the spine, like you cannot obviously adjust that person. But this technique, you can adjust anyone.
Yeah, well, I understand. Yeah, like you're talking about like a thrust-based adjustment or
force.
Using an active force adjustment. So you, obviously in chiropractic school, you learned that, what you said you were doing traditional chiropractic. And then you said something, we met so many mentors along the way.
Yeah.
When did you graduate?
So we graduated 2012.
Okay, so 13 years ago, roughly. And how long have you been doing, when did Kinfolk open?
We're in our 8th year here.
8th year. So 5 years you had many mentors. That's remarkable.
Oh, I mean,
you must have been working very hard.
Yeah, well, it's, you go through school, you go through the educated process. I'm sure you had the same thing when you went to naturopathic school, but you don't learn how to serve people. And that whole process of being around mentors, being around people that were in practice, you actually get to see the transformation. You get to see how we use our language. And it's a human experience. It's not in a textbook.
Well, it's remarkable because it sounds like, it probably still are, but after school, during school and after school, you spent a lot of time refining to develop what you guys now do.
Yes.
Which most of the DCs or chiropractors that I've run into, and it's just me, haven't done that work. And it's not that they need to, but you worked really hard.
Well, and I think you want to find what is uniquely you. Like what comes through me when I'm with someone and I want to help them on their healing journey. And this is our personality. It's grounded, it's soft, it's gentle. It's, I don't know, it's more inviting, it's more open, it's more curious about the body. It's not meant to be mechanical. We're not robots, right? We're energetic beings, like we said earlier.
Yeah.
And so you get to work with that bioenergetic field of the human being, which is so important.
How do you feel when you come home from a day of work?
You know, we actually feel quite well. You know, we work half days. You know, I think you set up your schedule and your life to really balance serving, because you can overserve. You can over-deliver and overserve. And I noticed that like first 2 years in practice, there's like that burnout, right? You're just giving so much to your practice, so much to your people. And so it was a good lesson to learn that, okay, you got to step back. You got to take care of your body, your mind. You have to do things, be in nature, and balance yourself.
What were your first 2 years in practice like?
Hard, really hard.
What types of, did you do traditional chiropractic during
Traditional
that time?
chiropractic, yeah. Osseous adjusting.
Okay.
Yeah. Shorter sessions. It'd be
Okay.
very different than what you see back here, what you experience back here.
Okay.
But traditional chiropractic, still from a center of love and service, you know, but it was very different. The model was different.
Explain how you've set up your office, because it feels so great in here. And I'm not even in the treatment area. This is the waiting area, or the waiting. This is, what do you call this area? I don't know.
It's called the lounge.
The lounge.
It's the lounge.
Indeed, yes. So I'm lounging in the lounge, and I spend quite a bit of time in here. When I come in, when you're adjusting patients, I hear certain types of music. So
Right.
is it a functional design?
Yeah, everything's intentional. You know, we pick a certain incense that has benzoin that helps relax the parasympathetic tone in the nerve system. We have music that plays with vibrational attunement to help relax your nerve system. The materials we pick, earthy materials, natural products, wood, you know, things that are of nature. That's all meant to really create safety in the body. It's meant to be familiar. You touch it, you interact with it. And this building is an old building. It's got a great grounding energy. We call it the temple for a reason. Like, it feels like there's a temple. Like, this has been here for ages.
This building?
Yeah. So it's one of the first buildings on Fifth Avenue.
Oh, really?
Yeah. So it's a historic building in our mind. And yeah, the music we play, the lighting is so important for the nerve system. You know, you don't want flickering LED lights all the time, especially if you're trying to relax. So we have dimmer switches on everything, which was a big deal to get that in. So we really try to curate, they call it a neuroaesthetic experience. And
they call it, or you call it?
They call it.
Okay.
I just love the term. And then we did a deep dive into, okay, what kind of environments help people relax?
Okay.
You know, what type of music? You'll notice the music, there's no English words.
Yeah.
Because we
Let's
don't
talk
want you
about
in your head. We don't want you thinking. You know, we used to play John Mayer first, second year in practice. And it reminds people of too many things because of the words and the memories with the music. This is usually mantra music. So it's just pure vibrational. It's all Sanskrit.
In some way, even though I don't understand Sanskrit, do I understand this music when I'm here?
You do. Your body does, because it's all vibration, right? Like, your body is, you're listening to it, but your body is encoding the geometry of sound into the body.
I love that. Our body's encoding the geometry of sound.
Yeah,
with
you're not
great
just
intent.
hearing it, right? It's a vibration. There's waves. Like, it's a shape, and it changes your shape internally.
How is that reflective of then the treatment that you do? Because you had told me, I'm a patient here, and I have been for over a year now. Yeah. So I was referred here by somebody very special to me, and it really helped me. Yeah. And you told me that every time you come in here, intentionally, you want your body to have the same experience and to remember certain things, like the blanket.
Right.
So what's the patient experience like?
Well, when you come in, we didn't want it to be a white coat clinical type of setting. So it's come in, relax. And then as far as the adjusting goes, it's a 20-minute meditative adjustment. You mentioned the blanket. We put the blanket on because it creates sensory deprivation. It allows you to drop into your body. And a lot of people say it's comforting. Once the blanket goes on, they've been so entrained with the adjustment. So every time they go inward And when you go inward, magical things happen with the nerve system.
So you put a blanket on, but you don't cover my whole body, and
No.
I remain clothed.
Yeah.
So I come in without my shoes,
Yep.
and then I take a face cover and I go to the table that's open,
Yeah.
because I've been trained, and I put my face cover down and I I lay face down.
Right.
How come you always start us face down?
There's something about the backside of our body.
Mm-hmm.
It doesn't get touched, right? We move forward, we handshake, we interact in the front of our body. This is like the motor side of the nerve system, right? But the backside, this is the sensory side.
Mm-hmm.
And there's something about the sensory side of the nerve system that doesn't get the attention that it needs. So as soon as you go face down, I need to know, what's the tone of the sensory side? What am I feeling in Dan's system today?
Mm-hmm.
And each time I adjust you, it speaks to something different, and then I get to start the adjustment.
And so you put a blanket over, a folded up blanket, so there's some
just a
weight
half
to it,
blanket.
which is comforting and reduces anxiety.
Exactly.
But and I've often wondered, and I've obviously never asked, but you can even feel that through the different layers of my clothes and the blanket itself.
I would say you feel more.
As a practitioner.
As a practitioner,
Yeah.
I feel more. You're tuning into like the subtlety of the system, right? And Sera used a great analogy. It's like if you take saran wrap, right, and you were to drop a penny into the saran wrap, you would see it ripple through the saran wrap. You would see it undulate the system. The same thing with the blanket is I can put my hand here and I can see how it changes through this fabric into the upper part of the system. So you're using it like as a medium, right? And it's all connected. So it's a beautiful way to just feel the total connection to someone's posterior or backside of their system.
What happens at the end of an adjustment?
When I check you, recheck. So I think this comes a part of like rituals, like how do you open a ceremony and close a ceremony? And I think the opening of the ceremony is you going face down and the blanket goes over you. This is where we start the ceremony. And then when you come up, the blanket comes off, you go seated, and then I do one final check. And the big check I do is C1, which is the first vertebrae. And I'm just checking the tone to feel it's balanced. And that's it. That's the last check.
And I have to breathe a certain way during that.
I usually have people take one final breath in, and then they release the breath. And that's how we close the adjustment.
And if you sense something out of balance with C1, do you adjust at that time?
I would say go face down, or sometimes I have people lay on their side.
C1. Why is C1 so important?
It has the most nerve input from the nerve system. There's so much. This plexus, this neural plexus, it's the closest to the brain, right? So there's so much autonomic functioning happening there. And C1 it's how we see the world, right?
Explain what's, for our listeners who don't know anatomy, what is C1 and what did you mean by it's how we see the world, and what is the autonomic input?
So C1 is the first vertebrae of the spine. So you've got 7 in your neck, right? C1 is the top vertebrae, right? And I say it helps us see the world because it's a rotational segment, right?
Your head rotates directly on C1?
Yeah, right? Like we call it the atlas, right? And actually in anatomy, they call it the atlas. It's C1. But I think to me, it's how we see the world. It's how we see our perspective of life. And it's how we move through life. So it's the last final segment that I like to check in that area. And then autonomic function, your heart rate, your blood pressure, your breathing, all of that is very close to C1.
Things we don't think about controlling, but
they're
that
all
have to be
autonomic.
controlled.
Exactly.
So if you're C1, your atlas is malaligned or energetically deficient? Or
You could say that. There's one technique where they only adjust this one bone.
I was going to ask you about that and how does that, some people may be, and I think it's Nuka?
Yeah, Nuka.
Okay. How does this differs from Nuka then?
This differs from Nuka, but Nuka is just like there's one bone that if you can just correct that one part of the system, it translates down the entire nerve system. And I've had Nuka. I've had upper cervical work before. It's beautiful work. But to me, I feel like I love interacting with the entire system. I like to dance with the whole system, not just one.
But the adjustment that you do on C1 is different than what a traditional Nuka chiropractor would do.
You could say the mechanism is different, right? Like the hands-on experience is different, but I feel like every chiropractor has the same intention. It's to remove interference. It's to restore balance, right?
Most people who have been to a chiropractor, or maybe all people, they get a crack. There's an audible. There's a force apply. You still apply force, but there's a significant force in traditional chiropractic. So what is kinfolk?
Yeah.
I mean, it is what you've just described,
Right.
that whole experience. But it's a blending of different therapies, or explain maybe if there's additional philosophy.
So I think most people would understand it as a tonal model. Like
Okay.
We're working with the tone of the nerve system. And to us, the nerve system doesn't need to be yelled and screamed out. It's not about manipulating a bone out
Okay.
of place. It's about restoring the tone of the body. So you can look at a guitar string. Like
Okay.
most people come in here, a guitar string that is over-tightened, over-tuned, it feels very tight. You can't play music on that string. People lay on these tables, we're all over-tuned, right? Or we're out of tune. So this type of technique is about making small micro adjustments, tuning the instrument, tuning our body to a way to where you don't feel that tension anymore. Your voice feels different. Your breath feels different. Your circulation restores. You get into parasympathetic state. So it's more of a micro attunement rather than one big force going into the system.
Wow. What would Dr. Sera have to say about that?
We could ask her.
Can we?
You want to step in? Come on in.
Hi, Dr. Sera. I have always been wondering, how are you two so philosophically, energetically, practitionerly aligned? Like you developed this together, right? That's
did.
very unique. And then you facilitate it in patient care together.
Right. So I think in school we had one mentor.
Mm-hmm.
Her name is Dr. Autumn, and she honestly, I feel like she changed our lives.
Mhm.
And so I think we went into chiropractic school to become chiropractors, so like this educated experience. But every Wednesday night we would go and we would sit on her floor in this circle, and we would do the inner work together. And so Keiko and I, we were roommates, we were best friends, and I feel like we had this healing inward experience. And so because we were able to discover ourselves and have that together, we just see each other.
Mm-hmm.
And then we would start to create this vision of this practice we wanted to build together. So I feel like we had the inward journey together, we had that educated experience together,
Wow.
and we just shared this vision that both came from our hearts. And I feel like when our hearts aligned, everything just kind of fell into place for us.
Do patients ever come here and then are like, this isn't for me, or this isn't what I expected?
You have to be ready to do the work.
Okay.
You know, we're not here to fix you. We're not here to crack your back. We're here to have a guided, facilitated inward journey.
Mhm.
And people who are not ready to look at their stuff, they're usually, they're not ready for it.
But what if they're just like, I'm a runner and I have chronic hip pain?
Yeah, I mean, they can lay on the table and they'll have an experience of tension being melted out of the body. But I feel like the work that we do, there's so much mental and emotional components to it that we love supporting people beyond just the physical body.
Right, but do those people, if they're not, say, ready to do the work because there may be something besides their biomechanics
Right.
causing that hip pain?
Exactly.
And so do people ever come here and then say, I'm frustrated, this doesn't seem to be working? Maybe you do a consult with them and say, like, here's some other things to explore?
Absolutely.
Okay.
Yeah,
and
we
that's
just
how it
add
works.
to their team.
Are some people not ready for that?
A lot of people are not ready for that.
Wow.
Yeah.
It takes courage to go deep and to face some of those things.
It does.
I mean, I experienced it. I'm not sure that I could have faced some of the things that I had to face energetically, physically, if it weren't for your types of treatments and coming here and feeling a safe place.
Right. And I think that that's the most important thing. And that's the beautiful thing about the nervous system is we have an experience that comes in and it is painful. Our nervous system is designed to take us away from that, right? And so we store that tension in the body. So when we create the safe space and we are guiding you through the sessions, we're guiding you into that tension or into that compensation or into that defense mechanism. But underneath that is the thing you didn't want to look at. So I feel like that's why.
So you can help facilitate dealing with it or release of such elements without words.
Exactly.
Spoken words.
Exactly.
So you mentioned the word conversation, and I was just getting ready to ask you if kinfolk was a language.
Oh. I feel like it's an embodied language. It's a feeling. Yeah, and I feel like I think it is a language that we all intuitively know. You know, it's like that feeling. It's the language of touch, and it's it's really our first language coming into this world is the language of touch.
Of touch.
Yeah.
I think it used to be that touch was with a metal instrument
Right.
versus hands. The hands are still gloved
Yeah.
in America
Yeah, for
for
sure.
the most part.
Yeah.
For the most part, right?
Yeah.
And other cultures, it's skin hands,
Yes.
not gloved hands.
Yeah.
That conversation that you have, this language, is something that you developed, you and Dr. Keiko
Mm-hmm.
specifically.
Yeah.
Have you taught anybody else to speak this language?
We're in the midst of teaching a few students currently.
Okay.
But yeah, I feel like as our community grows, we see the demand for it, or
Mhm.
people are hungry for it, and they want to know where
Who are the chiropractors?
our clients,
Oh.
like let's say someone moves away. It's just like, where can I continue this type of care? And it's difficult to find. And so in that sense,
I remember I was looking for a body worker who could relatively speak the same language, so to speak.
right.
I mean, early on, and you didn't have anybody to refer me to because I wanted that same continuation of care, even though it might have been a different dialect. It was still the same language, so to speak.
Right.
So I experienced that for myself.
Yeah.
Like somebody who could do a massage or something, but with the kinfolk spirit, so
Yeah.
to speak, or something like that. It was that important to me. I remember that Dr. Keiko had told me that the psoas was somehow related to anxiety or the parasympathetic nervous system. And I never, I was like, really? Okay. And then she proved it,
Yeah.
right? Because she treated my psoas, but I never understood how that was, or, because to most of us, that's a muscle, right?
Right.
And of course it has a nerve, and a nerve, the muscle moves with the nerve, and it has all the regular muscle stuff, but it certainly doesn't have anything to do with anxiety.
Well, the psoas is a very interesting muscle, and we don't call it a muscle. We call it a messenger.
The
Because
psoas.
Yeah, the
Is a
psoas
messenger.
is a messenger because of the way that it grows from the midline out. There's no other muscles that really do that.
Whoa.
And so the fact
You
that
mean embryologically?
yeah. So the way that the psoas grows it's like a centrally mediated muscle. So
Whoa.
because it's a messenger, and if some like one of your psoas is tight, to us that's like it's a message that you're living out of alignment, and your psoas is there to bring you back into alignment. One of the greatest teachers that we have is Liz Cook. I believe she's in California, but she told us that under a microscope, if you touch the psoas, it recoils like a caterpillar. And so she teaches people to really tune into the tone and the messages of their psoas to bring them back into alignment. And again, that's one of the reasons why we work with the spine. I mean, it's our central orientation. We orientate ourselves around our spine. So it's just this way of finding your center. It's like such a common,
That's fascinating.
find your center.
And
But really, it's about living in alignment.
And that muscle's the only one that grew centrally out.
Yeah, it's an incredible, it's not really muscle in the way that we
Oh,
think about
because it's a central,
muscles. Yeah.
it's the only tissue that we would consider muscle tissue in
Yeah.
histology, but it's
Yeah.
a messenger. So do you start at the psoas?
When we're working with the system, we're just feeling the general tone, the feeling of how the spine is waving. So that's what sometimes it'll take us into the psoas, but for us, you're just sort of sensing this personality of someone's entire ecosystem. And then they're going to guide you. I mean, sometimes you have to adjust the front of the body. Sometimes you have to go into the cranium. Sometimes you have to adjust the foot. It's just, where is this person storing this imbalance in their architecture of the body?
The types of adjustments that you do, they're with a force, but they're not high thrust or high force thrusts.
Right.
There's certain ways that you kind of click your knuckles. I don't really know how to explain it. What is it?
Yeah, so we're creating an impulse.
Okay.
So what we're doing is we're applying a force over amount of time, but we increase the time instead of increasing the force, which creates the impulse for your brain to pick up on it. And we intentionally are very light because of how light touch impacts the brain. So light touch increases this sense of self-awareness or interoception. Interoception is just being able to feel the sensations of your body. But when people are in stress mode, or they have an experience that come in that is traumatizing, we disassociate, we leave our bodies, right? And so by gentle touch, we're bringing people back into their bodies so that they can process this tension that's keeping their energy stuck.
It's amazing.
Yeah.
The selecting a student or so who is interested in maybe having a kinfolk or learning your technique, or I don't know what you guys have planned, but that must be tough too. I mean, if you found each other, that seems like a rarity.
It is. I feel it's something that's super special. Yeah. And I feel like there's people out there, and we are calling them in.
So if I were to need to, well, I do need to explain this, well, what is kinfolk, or why would you refer me here? Or for people who are watching this that are local to the Phoenix area that are interested in maybe calling up or go to the website but don't fully understand, like, what would I say to them? Like, kinfolk, well, let me tell you what kinfolk is. I say it's a meditative adjustment, but then I get all bubbled up. I'm like, I don't know, I just have to show you, or I need to make a video and you need to watch the podcast, you know?
Yeah, it's an experience. You know, we always say really simply, like, we take people from tension to relaxation so that they can embody their potential. Because it's really about, we live in such a contracted mental state where it's really about just getting people to relax, come back into their bodies, realign with who they are, what their purpose is, what their meaning is, so that they can show up fully in whatever capacity that is for them.
Beautiful.
Yeah.
Thank you.
Thank you.
This is lovely.
Yeah.
I love what you guys do. Thank you both for spending time and for the healing you've helped me get through, and for being a resource for people and patients, and for teaching students, and for being lovely, beautiful doctors that you are.
Thank you.
Rubin On Point. Thank you for joining us on Rubin On Point, a podcast about cancer, resilience, and most of all, about being human. I hope today's conversation inspired you to see new possibilities for growth, healing, and strength in your life. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with someone who could use a little extra resilience in their day. Remember, no matter what challenges you're facing, resilience isn't just about bouncing back. It's about building a life of purpose, connection, and vitality. Until next time, stay strong, stay healthy, and take care of yourself and those around you.